Hello and welcome to this introductory video looking at the new NHP Models of Care Evidence Map. I'm James Sandy from the Strategy Unit and I'm joined by my colleague Alison Turner, who's our Head of Evidence and Knowledge Mobilisation. Alison, welcome, and we're going to look at what this map is for and importantly, I think, how it can help folks.
Yeah, sure. So we're launching this new Models of Care Evidence Map, which is designed to help NHP projects in their planning. So the idea is to provide easy access to evidence on new models of care, which may have an influence on demand and capacity. And I guess people may have heard about the map through the Models of Care methodology, which also talks about how to use the map alongside the demand and capacity model and various other clinical and engagement strategies.
And there are some kind of building blocks, I guess, in terms of how the different elements of the map fit together to sort of help people navigate it.
Yeah, sure. So I guess the part of the reason we created the map was that there are lots of different strategies and interventions health systems might undertake to help manage demand and capacity. And it wasn't really feasible to try and synthesize the evidence on all these different approaches over the years. So we thought an evidence map would be quite helpful. I will just share my screen. So the sheer breadth of approaches and interventions out there does make evidence synthesis not entirely feasible. So we thought an evidence map would be helpful. And a map is really essentially a navigation tool. So it helps you to see what evidence there is, what is the knowledge base around a particular approach, strategy or intervention at the moment. And as you can see from this diagram, there are lots of different benefits of using an evidence map. So it's very helpful because you get that quick, easy to use overview of the evidence. It's interactive, so you can engage with the different evidence by looking at different outcomes, for example, or different strategies. And one of I think the main benefits of a map is that you can easily spot where there might be gaps or uncertainties in the evidence base, which is quite helpful because that might show you where there might be where you might need to do some evaluation or some engagement with your local communities or clinicians, for example. Now, an evidence map is created by pulling together and charting information from the different evidence sources. And so once you have that foundation in place, it's very easy to keep updated. And we'll be updating our map monthly. But importantly, it also leaves a sort of legacy product for future programs. So it's always there and can always be added to relatively easily to keep the evidence base up to date so that you can use that to inform your planning.
And as you've said, this is an interactive map, an evidence map, which is designed to look different and to change as people use it and add more to it. And I guess that in that sense, it's a kind of iterative process, isn't it? You're kind of building and learning as you go with the map itself.
Yes, yeah, and I think for this first iteration, we have focused on quite a narrow focus and just looking at evidence on interventions or strategies which specifically report a quantitative impact on hospital activity. So whether that's length of stay or hospital admissions, readmissions, outpatient attendances or A&E attendances. And we will be broadening that because we recognise that's only a small part of the picture. And also we want to incorporate qualitative evidence because it'll be important to understand what we currently know about implementation of different strategies. So we're sort of looking at a small picture at the moment and we'll expand on that. And I think one of the main advantages of this approach is that by doing this once at scale, it will reduce duplication across many different projects because we should only need to do this once and then we can continue to add to that as the programme progresses.
Now, there's lots of information, lots of detail, lots of evidence within the platform itself. And we will, over time, I think, explore some of that as people need it. But let's just now move to giving people just a bit of a demo, really, just a bit of an overview of what that map looks like and how they might come across it, but also how they might use it practically. Okay, so Alison, we're going to look now at a bit of a demo, really, in terms of what the platform is and how folks can use the evidence map practically. So over time, obviously, we'll look at more of the detail and explore some of the features as people come across them. But yeah, let's just give people a sort of an overview of the platform we can see here.
Yeah, sure. So this is the page that you'll land on when you access the evidence map. So you can see there's a little introduction here that gives you a little bit of background, just reminding you some of what I've said already. And we've licensed this under a Creative Commons license, so people are able to use this with acknowledgement, for example. And then on the left-hand side here, you have a menu, which you can just sort of appear or disappear as you need to. And you've got 4 options here. Now, because this is quite new, you might find that we make some small tweaks in response to feedback. So you might see occasional just things that look slightly different as you're using it, but the functionality will be the same until we do come on to release 2. So I'll just show you, there are 2 different ways of using the map. So you can browse using this summarize evidence option here, and I'll show you the search option shortly. But essentially, this is a sort of a tabular way of looking at the evidence base. And I think probably my most useful or the most useful table I find is mechanism and outcomes. So for example, you've got evidence on different outcomes that are reported here. So there are papers that report A&E attendance, for example, hospital admissions, length of stay, outpatient attendance, and readmissions. And we've sort of categorized all the papers that we found, all the different evidence sources, into one of 6 mechanisms, which we'll explain in the taxonomy. So I'll come on to that. But essentially, we're talking about substituting services or roles, relocating services, redirecting, preventing admission or hospital activity in the first place, and efficiencies, and a little bit about de-adoption as well. And for most of this, we have focused on system level interventions, because we're looking at interventions or strategies that are scalable across different health systems, with the exception of this efficiencies mechanism here, which includes some hospital level initiatives as well. So, for example, initiatives to manage the did not attend in outpatient attendances, for example. And the way that this table works is you can just click a cell here. So, for example, if I choose what strategies are available to substitute A&E attendance, and there are 36 different papers that report on this, and we've got this lovely little waffle chart here that shows you the proportion of papers that are looking at that. And if I just scroll down here, you'll see that the papers are listed here, so it just automatically pulls together the relevant papers for you, and then you can have a quick browse through here to see which of these are relevant to your current plans, and you can just scroll through, for example, to the next page. Now, all of these papers are linked to from the map. If I just click a link there, just to give you an example, that will take you to the page. And most of the papers are open access. There are just a few that are behind a paywall, but they'll all be accessible via your NHS library service. If you speak to your local librarian, they'll be able to help you access anything that is behind a paywall. Now, we also can search the map as well. So, for example, by typing, say, virtual ward, if I can type that in and spell it correctly. So, virtual ward, and don't worry too much about the search string distance. You can leave that as it is. And then if we click that search button there, and you can see that we get a set of results. Now, this looks like a duplicate at the top here, but that's because it's reporting on more than one mechanism. So at the moment, it comes up in the results for each of those mechanisms, which explains why you might see a couple of duplicates. But you can see that you get a load of papers here that are talking about virtual wards and the impact on demand and capacity. And we can just click there to the next page of results. So for the most part, these are journal articles, but there will also be reports as well. So we've searched bibliographic databases like Medline, but also grey literature sources. So organisations like the Health Foundation, King's Fund, Nuffield Trust, and various other people who are producing evaluation or an analysis on demand, capacity and models of care. And then the taxonomy tab just over here, this would explain the different mechanisms. So we've given definitions because sometimes it's a little bit unclear what we mean. So we've explained the sort of definitions and given some examples of what interventions might be included within that. And then just further down, you can just see that the other sort of aspects of the taxonomy we're using. So, for example, primary and secondary research, different types of outcome, and then effect. For some of this, where we can output results, we also give an indication to whether there's an overall negative or positive effect or mixed effects. If I just go back to the original table, and perhaps show a couple of other just examples. So, for example, prevent hospital admission. And you can see this type of thing that comes up there. So we've got things including medication reviews in care homes, for example, prevention-focused integration, enhanced model of primary care. So you can see the types, breadth of approaches and strategies that are included in the evidence map so far.
So this is really powerful tool, isn't it, in terms of helping people find and make sense of some of those sources of evidence that are part of that sort of planning challenge, really. So there's a lot here, but it's growing as well. I think the scope is initially quite narrow, but is broadening as we go.
Yeah, absolutely. So at the moment it is focused on quantitative evidence, and we know that when we're using evidence to make decisions or to plan, that we need a whole breadth of evidence, and so we will be expanding the map to include qualitative evidence, but also to look at outcomes beyond hospital activity. So for example, we might be interested in economic evaluations which report costs, and we're also we've had some feedback from a couple of initial demos that people would find it helpful to explore some evidence around associations between different aspects of the health system and how that might impact capacity and demand. So, for example, what's happening in primary care, and then the relationship between demand of hospital activity. So we'll be expanding the scope, and we'll be sharing a little bit more information about that over the summer. But in the meantime, we'll be keeping the map up to date. So we'll be updating monthly. And we've yet to agree the date for that, but we will be sharing that on the map, so you can see very clearly how up to date the map is and how much has been added since the last time you've used it, for example.
I guess just finally, Alison, there are people watching this snapshot really of this tool who've probably got things that they want to ask or add in or give feedback on, but we're very much open to that, I think.
Absolutely, definitely. So we've demoed this to a handful of people as we've been developing it and had some really useful feedback. But I think it would be really helpful to just get a sense from people how useful they found it and what we might be able to do to improve that to make it easier to use, and also feedback on the scope as to what people would like to see included in the map. That would be really, really helpful. So we definitely welcome that, and we'll try and find a mechanism to invite feedbacks more easily.
Great. Alison, thanks so much for walking us through that and explaining the new NHP Models of Care evidence map. Thanks for your time.
No problem. Thank you very much.